This video provides basic information regarding Weck Hem-o-lok Take Apart Endoscopic Ligating Clip Appliers, which are designed to deliver Hem-o-lok ligating clips through specific size trocar cannulas. Other ligating clips cannot be used with these appliers. Hem-o-lok polymer ligating clips are intended for use in procedures involving ligation of vessels or tissue structures. Surgeons should apply the appropriate size clip for the size of the vessel or tissue structure to be ligated so that the clip completely encompasses the vessel or tissue structure. Teleflex offers take-apart endoscopic clip appliers designed to fit medium, medium-large, large, and extra-large clip sizes. Each clip size also has an appropriate clip removal instrument that can be used to unlock and remove clips from vessels. Please note, if you are using a take-apart applier, you should disassemble the device prior to cleaning and sterilization. Appliers are etched with either a dot or an arrow. Applier shafts identified with dots must not be combined with applier inserts etched with arrows. To disassemble the instrument, ensure handles are in the open position. Fully depress the release button and close the instrument handles. Release the button and then open the handles with both hands and some force, noting the audible click. Close the handle and remove the insert from the shaft. Release the handle. Unscrew the locking nut and remove the shaft from the handle. Connect the shaft to the handle, screwing them together. While holding the release button, slide the insert into the shaft and align the arrow or dot on the insert with the arrow or dot on the shaft. Do not force the pin into the slot. Let go of the release button. Squeeze the handles with force until you hear an audible click. Confirm that the insert is engaged with the release button. Check engagement of the insert pin into the shaft slot. Test the applier by squeezing the handle several times, ensuring that the jaws open and close properly each time. It is recommended to follow hospital, AAMI, AORN, or regional standards for cleaning and sterilizing your appliers. Please refer to the IFU contained in each package as a guide for cleaning and sterilization procedures. When using take-apart appliers, remember to brush down the lumen of the instrument with a bottle brush as well. Manual load applier jaws are delicate and easily damaged, as can some other applier components. Damaged components may not allow clips to close for acceptable occlusion of intended structure. Please inspect instruments after each sterilization cycle for rust, pitting, cracking, burrs, staining, discoloration, and worn or broken parts. Always check the alignment of the applier jaws before use. When closed, jaw tips should be directly aligned and not offset. Our Weck 360 service program provides you with an applier warranty that offers you repair and replacement of appliers at no additional charge to your facility. Weck laparoscopic surgical appliers are covered by a 3-year warranty on defects in materials and workmanship, and a 3-year warranty repair service on tip alignment and refurbishment. If you notice any sort of defect during your device inspection, please contact your Teleflex surgical sales representative to have the applier serviced.